75 degrees, sunshine. Coming up before the hour's up, we're going to talk with Mark and Christian. They call themselves the Schmoes. They're at Comic-Con. We'll talk about that and also about Spider-Man, Batman, a lot of movies coming out that you might be interested in seeing. Now, Dr. Jan Hawkin. Dr. Hawkin, how are you? Welcome.
Thanks so much for having me.
Absolutely. So speaking of movies, you are actually releasing a movie that's called Mind Zone, Therapists Behind Front Lines. And you are a professor emeritus of psychology at Portland State University, a clinical psychologist, and along with that, you're also a documentary filmmaker. Very cool.
Yeah, and they all relate in ways that I think are apparent in the films. That I bring a background of psychological theory and questions to all of these projects.
All right, so a little bit about Mind Zone, Therapists Behind the Front Lines. For folks, I'm just kind of give them an overview or kind of set the stage for what this movie is about.
Well, the military has made considerable efforts over the last decades, and the recent decades, and particularly over the last decade with the ongoing wars in Afghanistan and Iraq, to deploy combat stress control units as far forward as possible to treat soldiers near the front lines, infantry, but also support those in operational roles, support roles. And the aim here has been to keep soldiers in the fight, but also to take care of them and to prevent long-term mental health problems such as post-traumatic stress disorder and to deal with the alarming rates of suicide among troops. There were questions early on around the ethics of this mission these therapists are assigned, whether you can both take care of troops, their mental well-being, and also put them back on the line very quickly. And normally therapists wouldn't put people back into traumatogenic situations. They would encourage people to
do something else.
Do something else. But in the military, that something else is not a very good option. So and a lot of my work focuses on the role of psychology in everyday life and dilemmas around the use and abuse of psychology. So I was very interested in this question that, on the one hand, seemed like a very progressive move on the part of the military. And the military was, I think, rightfully proud of how many resources they put into mental health services within the military. Most people are aware of the problems of returning soldiers and the troubles of the VA, but not so much about the programmatic mental health initiatives within the military. In the field of psychology, this work has been very controversial and heavily critiqued, but the public has not been very involved in those conversations. So my interest was in embedding with a combat stress control unit, which I was able to do in the military. The Army supported that proposal to see, well, what are they doing there? Yeah. And is this really in the interest of soldiers?
And, okay, so you were actually embedded with them while not only at their pre-deployment training at Fort Lewis McChord, but also you were there with them in Kandahar, Afghanistan last year.
That's right. And it was an ideal time for a filmmaker. I mean, I couldn't be there for extended periods of time, but I was there during the handover from the unit. They replaced the 883rd. Our crew got there actually before the unit I was embedded with arrived, so we were able to get a sense of the scene, what kind of mental health work was being carried out, and then follow the 113th, the unit we were embedded with, as they took on their new jobs, and the old unit trained them and how they worked and how they thought about their work. So Mind Zone is a unique film in that it really follows therapists. It's not about soldiers and veterans. It's more about therapists who are themselves soldiers, but also have this job of taking care of fighters as far forward as possible.
What do you think about the job itself? Is that something that personally you, if asked to do, could do?
No one has asked me that question. I mean,
That's why I'm here.
I have. I mean, this may sound evasive, but I don't know. And the shortest answer is no, but the long answer is I have tremendous respect for soldiers who are working under very difficult conditions, and most people in this country have a sense of a superficial politeness towards service men and women. You know, thank you for serving, you can get on the airplane first, but a lot of that is quite shallow and disconnected with the difficulties of this continuing war that is not, and it's not so clear what they're doing there, and yet they are, I think, trying to carry out what they've been assigned to do. And for these mental health teams, it's particularly difficult because being in a war zone there's a cultivated post-traumatic stress disorder in that setting, that everyone is expected to be vigilant and shut down a lot of their normal emotional responses, to be hyper-focused and on alert. And so these therapists are expected to separate out clinical problems from the everyday background of a war zone, which also cultivates a kind of suicidology, if you will. I mean, there are a lot of weapons, of course, and access to weapons is associated highly with suicide rates, having to think about death and lower your inhibitions around death and dying, killing and being killed. And the challenge of separating out clinical cases from that would cross a threshold of concern from the everyday mental health picture, which is quite grim, and it's a very depressing environment as well. And I found it overwhelming to think about what they were all being asked to do there, as well as these therapists. I have tremendous respect for them, but also feel a kind of responsibility as a citizen for looking more carefully at what we're doing there. And so this is one lens for looking at the work of soldiers in Afghanistan.
Okay. Dr. Jan Hawkin joining us on the wake-up call this morning. And again, the name of the documentary is Mind Zone: Therapists Behind the Front Lines. Let me kind of put it, let's look at it from this kind of angle for a second. As you watched these particular therapists work in that particular environment, knowing what the goal was supposed to be, do you think that they were doing a good job addressing the needs of the soldiers at the time, as well as keeping their mind in the game, so to speak, as required by the military?
Well, that's you touched on the most important factor here, and that is what's required by the military.
Right.
What's required by the military in a war zone ordinarily is very counter to what normally we would consider mental health.
Right.
And what the pressures on these teams to get people back on the line, and this is policy in the Army policy, that the treatment for stress reactions in the field is getting them back to duty.
Right.
That's even incorporated in the treatment. Normally, we wouldn't take someone who had take a child out of a violent family and give them a little resilience training and putting them back in that violent situation. That would be considered extremely unethical.
Right. And then, so my question is then, with those two things, which seem, they are counterintuitive, the question is, are they doing a good job? And I'm not asking for a moral judgment. I'm just, are they doing a good job in balancing those two kind of opposing things?
Part of the difficulty in assessing whether someone is doing a good job is that it depends on what measures of job effectiveness are in place, and there is very little feedback in that context for the long-term effects of what they're doing. Even the data, the studies of post-deployment mental health problems are for the most part an artifact of how those studies are generated and how the data is gathered. Over the last century, we don't have reliable studies of the long-term or even the short-term effects of war. There are these data are very driven by political factors and what people are willing to say of what they suffer.
Sure.
You can't do a blood test for PTSD or the depression of war. It depends on what people tell you. And soldiers in that context are under enormous pressure to say, I'm fine, and yes, I can go back. And I'm not going to kill an unauthorized target. And I think more than anything, I became aware of the power of organizational and institutional imperatives to rationalize what we do. We see this with these sports cases and how could these officials at Penn State rationalize this horrible behavior they knew about around child sexual abuse. Well, institutional pressures can be very intense, and people will rationalize what they're doing. So I think it's a responsibility for all of us to look very carefully at what situations we put our young men and women in the service, because the caregivers on the line will be under enormous pressure to make it seem as though it's all manageable. And they do believe that and have to believe it to keep doing that work.
Do you think that the work that they're doing and divorcing it from the one side of the imperative of getting them back on the lines, do you think that it's constructive, though, the work that they're doing to try and help these men and women cope with what they're going through on the battlefield?
It's not clear, and in the Mind Zone film, I have a variety of opinions on that, weighing in. I try to, as a documentarian, not draw the conclusion toward one singular, uncomplicated conclusion.
Right.
There are a range of opinions on that, but there's no clear answer. Some say that what they're doing could make be more of a problem in the long run because you feel like you're being helped, but are you really being manipulated? So there's one point of view that this actually doing a little bit it's like a little knowledge. The road to hell is filled with a little bit of knowledge.
Yeah.
This may have unintended consequences over the long term. And other mental health initiatives the military has tried out historically have had long-term problematic consequences. During World War II, they used sodium pentothal and to induce hypnosis and emotional processing of trauma in theater, in the theater of war, and later found that this made soldiers more debilitated after the war. So there's a long history of hubris in the military, thinking that we have the answer to controlling reactions to war, but it's a dangerous business with a lot of unintended, unknown consequences, and I think any initiative has to be approached, if you understand it historically, with a great deal of caution and humility, and that's part of what I'm trying to draw out in the film. Not that these people aren't aren't well-meaning and thoughtful, because they are, but they're caught in a very difficult dilemma for which we all share responsibility.
Dr. Jan Hawkin, Professor Emeritus of Psychology, Portland State University, clinical psychologist and documentary filmmaker. The name of the movie is Mind Zone: Therapists Behind the Front Lines. There is going to be a screening of that July 19th, and that's going to be at the Northwest Film Center, I guess, up in Portland.
At the Witzel Auditorium through the Northwest Film Center. And I did want to say that this is a work in progress and a chance for the community to come and respond to it before I complete it.
Okay, and are you ever going to, when you get it done, hopefully you'll bring it down to the Eugene area, because I'm sure a lot of people would be interested in seeing it.
I certainly hope so.
All right. Thanks for joining us on the Wake Up Call this morning, Doctor. We appreciate it.
Thank you.
You take care. It is 840 News Radio, 1120 KPNW.
It's your money. And this is your Wake Up Call Market Report on